In this next section, we'll discuss the diseases of the dog we're trying to prevent with vaccinations. When someone asks you, "What is distemper?" or "How is parvo spread?" or "Does my dog really need all these shots?" you'll need to be well equipped to give the correct answer. The diseases that dogs are vaccinated for are chosen because they have a history of being highly infectious diseases that often lead to death. When a disease runs rampant through the dog population, scientists begin the process of producing a vaccine to stop the spread of the disease. Once a vaccine has been in use over a widespread area for an extended period of time, the incidence of the disease will often drop noticeably. For example, the human disease polio was once a very common life-threatening disease, but after many years of vaccinating young children for polio, the disease is now fairly uncommon. What do you think would happen if we decided to stop vaccinating because we stopped seeing many polio cases? You guessed it. We would probably begin to see new widespread outbreaks of polio in unvaccinated children. The same holds true with diseases like rabies and distemper that we vaccinate our pets against. We'll provide a brief overview of these diseases so you'll see why it's so important to prevent them. In this section, we'll talk about the following diseases: distemper, hepatitis, leptospirosis, parainfluenza, parvo, corona, rabies, bordetella, Lyme disease, and giardia. Your familiarity with these diseases and their corresponding vaccines will not only make your job more interesting, but it will more importantly reduce the chances of an inappropriate vaccine being given. It is important to familiarize yourself with the type of vaccines given and the frequency at which they are given. There is wide diversity of vaccinations and administration protocols commonly used. Often, vaccines are combined or mixed into one vial so the dog doesn't have to get 5 or 6 needle sticks. It is important to remember that you should never try to mix different vaccines yourself. Closely follow the manufacturer's directions. This combined vaccine is often called the distemper booster because distemper is one of the primary components in this vaccine vial. It may also be called by the initials DHLPP. This coding represents the first initial of each component in the vaccine. Thus, a simple set of letters can tell us exactly which disease an animal has been vaccinated against. Let's begin with the D, which represents distemper. Distemper is a virus that affects unprotected dogs of any age. It primarily attacks the respiratory system, producing severe, thick discharge from the eyes and nose, resembling a severe cold. The central nervous system may also be involved, leading to convulsions or other neurologic symptoms. The dog may have other symptoms like a high fever. All combined, it produces a very sick dog and often leads to death. In dogs that do recover, they often have persistent nervous disorders for life. Following the initial exposure, symptoms can set in as quickly as a few days or up to 2 weeks. Dogs can contract distemper from a number of wild animals like foxes and raccoons, or more commonly from other dogs that come in close contact. Viruses in general are very difficult to treat, and therefore prevention prior to exposure is the best medicine. The H represents hepatitis, or infectious canine hepatitis as it is sometimes called. Infectious canine hepatitis is a virus spread by either direct contact with an infected animal or by indirect contact in the form of urine or stool. This virus attacks primarily the liver and sometimes the kidneys, resulting in a high fever, extreme lethargy, and loss of appetite. It can be life-threatening, especially in young animals. Sometimes we'll substitute the letters A or A2 for the H. When this is done, the A represents the type of virus causing the disease, or the adenovirus type 2. The L represents leptospirosis, or lepto. This is not a virus, but a microscopic corkscrew-appearing bacteria called a spirochete. This organism is spread primarily through the urine of animals, and it too attacks the kidneys and liver, with often fatal results. The early symptoms would be loss of appetite, fever, and vomiting. This organism is more commonly found around rural farm livestock. Your veterinarian may choose not to include lepto in the vaccine due to the fact that the geographic area may have a very low incidence of leptospirochetes. The other reason it may be left out is that lepto tends to create more allergic side effects than the other vaccine components. The 2 Ps represent parainfluenza and parvovirus. These are often both present in the vaccine, and thus both initials may be present, DHLPP. Parainfluenza is a virus that affects the respiratory system. It is highly contagious in congested areas with poor air circulation. This virus often combines with the bacteria Bordetella to cause a disease called tracheobronchitis, or kennel cough. The main symptom is a persistent cough. The symptoms generally become evident 5 to 7 days after exposure, so many dogs are home several days before they exhibit any coughing. A clean, well-ventilated hospital will help reduce the spread of this disease. Parvovirus is probably the most commonly seen of the diseases we are discussing in this section. This virus rose to epidemic proportions amongst dogs in the 70s. This virus attacks the digestive system, causing vomiting for the first 24 hours, followed by diarrhea, often profuse and bloody. This occurs because the virus attacks primarily dividing cells. The digestive system is lined with cells that are constantly multiplying to produce new intestinal lining. When this lining is stripped away by the attacking virus, the intestines are left without their internal mucosal lining, resulting in both poor absorption and bloody diarrhea. It is through the stool that the virus is transmitted to the environment. The virus is especially difficult to kill, allowing it to survive up to 5 months. A number of disinfectants effectively kill this virus. A commonly used disinfectant is a dilute bleach solution, 1 part bleach into 32 parts water. After an unprotected animal becomes exposed to the virus, it takes between 3 to 7 days of incubation before symptoms begin. Then the disease can last as long as 7 to 10 days. The degree of severity of this deadly disease seems to be diminishing with time. The primary victims of the parvovirus tend to be unvaccinated dogs under 1 year of age. Evidence suggests that there may be natural antibodies passed on to the pups that last longer than most maternal antibodies. Though this may be helpful early on, it tends to create interference between 8 to 16 weeks during the time we are attempting to create temporary vaccine protection. As a result, there may be value in vaccinating the puppy with another parvo booster as late as 18 to 22 weeks of age, hoping to stimulate a response at a time when we are relatively convinced that no maternal antibodies are still present. Several breeds appear to be more at risk: Doberman Pinschers, Rottweilers, and Black Labrador Retrievers. A C or CV may be included in our vaccine, representing the coronavirus. To simplify our explanation of the coronavirus and its corresponding disease, it often presents similar to a mild version of parvo. It causes diarrhea, but usually not as pronounced, and usually without blood. It also carries a much lower death rate. All of these vaccine components are commonly incorporated into one injection. The rabies vaccine is the other major dog booster given. It is commonly abbreviated R or RV for simplicity and consistency. Because of the widespread use of the rabies vaccine, the occurrence of rabies has dropped substantially. The virus that causes the disease can develop in any warm-blooded animal, but seems to be especially common in foxes, skunks, and bats. The virus tends to concentrate in the saliva, and thus spreads primarily from the bite wound that breaks the skin. Once the virus has entry into its new host, it migrates up nerves into the spinal cord and ends up in the brain. Here it can create paralysis of all or part of the body and inevitably death. Paralysis of the throat area creates an inability to swallow. This used to be mistaken for a dog that was scared of water. This, however, is not the case. In many areas of the country, the incidence of rabies is quite low. So why all the hype about vaccinating our dogs and cats for rabies? Here's why. There are very few diseases that people can get from their pets, but rabies happens to be a disease that is contagious to people. And to make matters worse, most confirmed cases of rabies in people result in death. Unless preventive measures are taken shortly after the bite of a rabid animal, there's a good chance that person will die. The number of rabies cases in a particular state seems to dictate how often a pet needs to be boosted. Some states require this vaccination every year. Others mandate it for every 2 to 3 years. Fortunately, the rabies vaccine is extremely effective at preventing the disease. That's why only 1 shot is required initially to provide the needed antibody protection. There are 3 other vaccines that are given to dogs: Bordetella or kennel cough, the Lyme disease vaccine or Borrelia burgdorferi, and the Giardia vaccine. The need for the Lyme vaccine and the Giardia vaccine varies by geographic location, so you should consult your veterinarian as to its need. Bordetella, as you may recall, is one of the bacteria that contributes to kennel cough. It tends to be a more significant problem where animals are brought together, primarily in kennels, at dog shows, and in grooming establishments. This disease, also known as tracheobronchitis, produces a deep cough that can persist for up to 2 weeks. It usually is not a deadly disease, but because it is so contagious, we are vaccinating to help minimize its spread to other animals. This disease requires several days to a week to incubate before symptoms start. Once a dog recovers, he can remain a carrier for the disease for up to several months in some cases. If proper quarantine procedures are not followed, hospitals may be prone to massive kennel cough outbreaks. Like any vaccine, Bordetella is not 100% effective at preventing the disease, though it does help in the vast majority of cases. The vaccine comes in 2 different forms, injectable and intranasal. This type of inoculation produces a better level of local protection and probably produces protection quicker than the injectable form of the vaccine. Remember, though, that the intranasal product cannot be given as an injection, and the injectable version cannot be given as intranasal drops. The intranasal form of this vaccine has been reported to cause mild coughing in some dogs up to 3 days after vaccinating. The vaccine that prevents Lyme disease is actually protecting against the Borrelia burgdorferi organism. Lyme disease is transmitted by certain types of ticks. Therefore, it is especially needed in dogs that are prone to greater tick exposure, like hunting dogs or dogs living around woods and water. Lyme disease presents itself initially with 3 symptoms: fever, lameness, and swollen joints. It can be quite serious, especially if not detected and treated early. The vaccine is the killed bacteria product. Initially, dogs will need a second booster in 2 to 4 weeks. Like most of the other dog vaccines, it too is reboosted annually. The prevalence of Giardia infection varies from state to state. Therefore, the usage of this vaccine also varies among veterinarians regionally. Giardia canis is a protozoan parasite that can be ingested by dogs from stagnant water supplies. The most common symptom of this disease is severe diarrhea that is coupled with a rancid odor. If not treated, this disease can lead to serious debilitations. A vaccine for Giardia is available and is given as a single injection which is boosted 3 weeks following the initial vaccine. It is then reboosted annually. We've just covered the most common dog diseases that are prevented with the aid of proper vaccinations: distemper, hepatitis, lepto, parainfluenza, parvo, corona, rabies, Bordetella, Lyme disease, and Giardia. Your understanding of these diseases will help you to educate the public on how to be responsible pet owners.